Welcome to the Putting the Public into Health podcast by Dr. Richard Pan. As we face one of the greatest public health disasters in a century, this podcast will address questions and issues from you, the public, about the COVID-19 pandemic and its impact on people's health and lives. I am Dr. Richard Pan. I'm a physician with a background in public health. I am proud to represent the people of Sacramento, Elk Grove, West Sacramento, and parts of Sacramento County and the California State Senate. I want to share with you important information and stories to help each other during this difficult time. Extremists who oppose efforts to stop COVID have been targeting public health officers for attacks, even at their own homes. On June 23rd, San Diego County Health Officer Dr. Wilma Wooten was insulted and had her home address read out twice at a Board of Supervisors meeting. I am pleased to have Dr. Holly Yang, president of the San Diego County Medical Society, join me. Dr. Yang practices palliative medicine at the Scripps Health System and is co-director for the UC San Diego Scripps Health Hospice and Palliative Medicine Fellowship Program. Thank you so much, Holly, for joining me.
Thank you for having me, Dr. Pan.
So tell me about the San Diego County Medical Society and what you are doing to address COVID-19.
Sure. So we are a group that represents the physicians of San Diego. We have about 2,500 members, and with students, residents, and our retired physicians, we're well over 4,000 members. So we're really proud to really emphasize the health and wellness of our community and support our physicians as they practice. Wonderful. And what we're doing for COVID is obviously this has been a really big concern. And so we've tried very hard to be an information source, help link our doctors to reliable information. We've actually had a call for volunteers so that people can be potentially deployed if needed in other places. And really tried to serve and listen to our members to see what's going on, do some environmental scanning to try to help coordinate information between systems and even giving information to the county when needed.
Mm-hmm. Now, the San Diego County Health Officer, Dr. Wilma Wooten, was insulted and threatened by a speaker at the Board of Supervisors meeting. Can you tell me a little more about exactly what happened?
Yeah, unfortunately, as you know, there's health officers sort of dealing with anti-masking groups, and apparently during when the Board of Supervisors was having open comments, it's all virtual right now for San Diego. One of the citizens here in San Diego, was insulting, and then it basically read out Dr. Wooten's home address multiple times. Unfortunately, that information was not cut off at the time, and the meeting kind of just continued sort of after that. So there wasn't a lot of commentary to address what had happened.
Now, I understand the speaker claimed that she was simply saying the address so that people could contact the public health officer to share their concerns and complaints. Is that a credible response?
I actually think if I recall what she said, she was actually saying, if you approve of what she's doing, please send your thanks to Dr. Wooten at this address, something similar to that. These are not very thinly veiled ways to sort of intimidate and harass our public health officers. I think it's completely unreasonable for anyone to have their home information shared who's really trying to serve the public. And so regardless of how it's stated, the intent of sharing people's home address and personal information, they can say what they want, but really, I really do think it is intended to intimidate these folks and to try to step back from really the important science and public health that they're trying to promote.
Mm-hmm. So the San Diego County Medical Society, I saw on Twitter and perhaps on other social media platforms, launched the I Support My PHO, I assume Public Health Officer campaign. Can you tell me a little more about that campaign?
Sure. We actually had sent a letter to our Board of Supervisors, expressing our support for Dr. Wooten, and also to sort of express some dismay and that there wasn't an immediate response to this particular caller, and one of the things that we wanted to do, and thankfully the Board of Supervisors here in San Diego has, they've all responded and expressing their support for her. But the reason to sort of launch the I Support My PHO campaign is that we know this is happening not only to our public health officer, but to public health officers across the country. So we wanted to do two things. One, to really support Dr. Wooten, make sure she knows how much our physician community and our community at large supports her in the work that she's doing to keep us all safe. It's a picture of our physicians or anyone else in the community who wants to participate wearing a mask, and they can hold up a sign saying supporting masking and supporting Dr. Wooten. And the second piece is really to see, to try to support our public health officers everywhere. Twitter's international. I mean, it's all over, so it's not limited to San Diego County. So our hope is that other people pick up this, and we've had some nice interactions with our other folks within medical societies across Southern California as well.
And how's there been response to this campaign by physicians and other people?
We are very proud that we've had over 100 physicians and other professionals sort of send in their photos to be sort of officially posted from our San Diego County Medical Society Twitter page. But certainly people, in the community can post their own. But we're really proud that there's been such great participation. We keep getting more pictures. People are sending pictures with their kids, with their partners. And we're really proud to see how much our physicians and other scientists in our community, even from our dental organization, one of the leaders there sent in his photo, and we're really grateful that people are embracing and showing their support, because one of the important things is we do not want the voices that I think are in the significant minority being louder than the people who are speaking up for public health. Who are speaking up for the health of the community, even in these really difficult economic times. I don't want to detract from that, but the faster we can get our communities healthy, the faster we can get back to economic health as well. So it's been really, I think, well received, and we hope it continues. We certainly have photos for days still to post, so we're excited.
Well, that's a fantastic show of solidarity. And I think it is very important, as you pointed out. In fact, I think economists have said that if we could get to essentially universal masking, with the occasional exceptions of children under 2 and people who have very significant respiratory problems, not just people who say they have respiratory problems,
right.
That we could actually help restore our economy, not fully, but certainly by slowing the spread of this disease. Remind people wearing a mask is an important step to bring our jobs back.
That's right.
Yeah.
No, and I think we're all very concerned about that. I mean, I don't think there's anyone who isn't affected by this, and we really, the economy is extremely important, but we can't get there without our people being healthy, our communities being healthy, and making sure our healthcare system is not overwhelmed. These things are critical. So masking is something that is simple, that we hope people really embrace, and I think people are starting to really pay attention, around here in San Diego, but also across the country. I know it's mandatory here in California, but I was still seeing quite a few people not wearing them, and I think I've seen more and more these days, because I think people are aware that, unfortunately, the COVID cases are going up.
Now, in the midst of this pandemic, unfortunately, we are seeing news reports of public health officers resigning. Several of them here in California have resigned, perhaps most notably Dr. Quick of Orange County, who resigned after she received death threats, significant enough to require additional protection, security. And she, too, had her home address announced at a Board of Supervisors meeting, which actually resulted in protesters coming to her home to intimidate not only her, but also her family. Are you concerned with the speaker calling out the address of Dr. Wooten, that Dr. Wooten would perhaps face similar harassment, intimidation? I mean, we've also seen other health officers where people have gone to their home as well and have made threatening remarks on social media and otherwise.
Yeah, I certainly, that is the thing that we are concerned about. It's really outrageous for people to intimidate anyone. I don't, at their home to threaten them, to make their family feel unsafe, regardless of whether or not you agree with someone. These are things that are not acceptable. So especially our public health officers who are working so many long hours right now and trying their best in a very difficult, in very changing situation. We're worried, and so we don't want Dr. Wooten or any of our public health officers to have to worry about their own health and safety more than they already do with COVID, right? I mean, the intimidation and the threats, whether they are veiled or outright, are completely unacceptable, and we speak very, very strongly against that.
Yeah, and unfortunately, we've seen these tactics before by, I won't say other groups, because it seems to be the same people. So prior to COVID, we had anti-vaccine groups harass physicians and parents who've lost loved ones to vaccine-preventable diseases and have posted in support of vaccination, and they've received death threats, bullying, not only online, but also then translated in person as well. Those violent memes they share on Facebook have actually resulted in actual physical violence and assaults. Here in the Sacramento, an anti-vaxxer threw blood onto the Senate floor while we were in session, and it's a way to try to interfere with the workings of our democracy. And the very same people, actually, the person who incited hate against Dr. Quick in Orange County was someone who was prominent in opposing SB 276 just half a year earlier. And
right.
The groups that are organizing online protests at health officers' homes turned out to be the same people who were also opposing vaccination laws here in California as well. So aside from Dr. Wooten, have other San Diego physicians been harassed or threatened for their public health advocacy? Is that an issue that the Medical Society has had to deal with before, either with COVID or even before COVID?
I think people have certainly gotten social media comments that are, rude and sometimes, I'm sure, threatening. I think the brunt of I think, Dr. Pan, I want to thank you because I think you've borne the brunt of a lot of angst and outrage. And I think our physicians here support your work promoting vaccinations, and also this new SB 483 to try to protect our public health officers. So I think we've had probably some amount of it, but in general, it's been mild compared to other places. But it's concerning. I don't understand fully sort of this issue with not promoting the health of the community, and actually protecting all of us. I think the fact that the groups are sort of the same and sort of not wanting to wear a mask and not wanting to get have people have vaccinations is really challenging. And we have to speak louder. We have to be compassionate. And care for our communities. It's really about the betterment for all of us, and to take care of each one of us. I do want to say that these things affect our communities that are more have issues with health equity more than a lot of other groups, and so we really have to promote things like vaccinations, things like masking, good public health measures protect all of us, especially these communities that we're concerned about, older adults, communities of color, the disability community. I really feel very strongly that it really is up to each one of us to do our part, and so we have to speak up against these groups that are actually quite a threat to all of us, but especially those communities that are more affected.
Now, I appreciate your leadership and the role the San Diego County Medical Society is playing in showing that solidarity, because oftentimes when you're subjected to threats and hatred, they try to isolate you. And,
right.
And so what happens is you wonder, like, well, where are the people who are with me, right? And
right.
Knowing that people are standing up for you, and I hope Dr. Wooten can see the support and that she's getting from the medical community. I think that's so very important to send that message to people, so they know that that it's not this small number of hateful people who you should be paying attention to. It's the much larger group of people who care about each other, who then care about the work that our public health officers are doing.
Absolutely right. No, I agree.
Yeah.
We have to have a louder voice. I do think it is very clear that the majority of people really care about this. They're very concerned about the spread of COVID and wanting to decrease the spread of COVID with masking and hand washing and staying 6 feet apart. I'm trying to reopen in a safe way and when needed, back away from that, even though it's very hard for our communities. Same thing with vaccinations. I think the majority of people absolutely support it, but we can't let these smaller groups that are more angry and actually are sometimes violent in their rhetoric, as you were, some of the posts that people put on social media that are completely inappropriate. We can't let that be the message that is the controlling message. The majority needs to be vocal, even if it's a bit unpleasant, because otherwise people are isolated and targeted, and that we need to speak up. So that's, again, one of the reasons why we felt that showing our support both with our faces, with our on social media, it seems small, but actually getting the message out there is I think critically important.
Oh, that's great. Are there any other thoughts that you have about what should be done to stop intimidation and threats against our public health leaders?
Mm-hmm. Well, I think calling it out. So if people are acting in a way, certainly everyone has a right to express their beliefs. That's what we certainly, you don't have to agree with everyone. But if people are being threatening, if people are being, are putting our health and our public health officers in danger, we need to call it out and say that it's inappropriate, and to denounce it. We need to use our voice. We certainly can have our community show up virtually if that's what's appropriate. And right now that's obviously the safest. At the Board of Supervisors to comment in support of these public health measures if there's something that needs conversation. But I think, making sure it's not the only voice that's being heard by our elected officials, by our community, is these sort of anti-science, anti-public health messages. We one of our past presidents put a op-ed in our local paper that's there today. Having our hospital executives speak out. All of these things are really important to show leadership from the medical and scientific community, so that people aren't confused. The public wants to know the right thing to do, and so we need to help guide them and not be quiet in the face of sort of unpleasant behavior. So I think all of those things are things that we can do that are helpful. And the more that we speak up, the less people are targeted, because there's more of us saying the same thing.
All right. Well, thank you so very much, Dr. Yang, for your leadership and everything that you're doing, and really appreciate you joining me today.
Oh, thank you, Dr. Pan. And I really am grateful for SB 483 and wanting that to pass, because we have to protect our public health officers. They certainly deserve it.
All right. Well, thank you. And thank you for listening to this episode of Putting the Public into Health by Dr. Richard Pan. If you have questions or ideas for a future podcast, please email them to senator.pan@senate.ca.gov. Please stay at home as much as possible. Stay at least 6 feet away from others outside. Wear a mask and wash your hands frequently. Together we are slowing the spread of the disease and saving lives. Thank you so much for listening.